I'm crazy. It's time for psych. All right.
Well, we already knew that, Dave.
That's right. Here we go. We're going to start on 51. We're going to work our way through this.
Oh, we started number 1.
Because we did that yesterday.
Oh, did we?
Yeah. So let's start at 51, shall we? 100 questions today on psychiatrics. 50 will be disorders. 50 will be medications. So, all right, 51. Which statement about ADHD is true?
Withdrawal.
Do you want me to zoom in?
Say what?
You want me to zoom in, or are you good?
No, that's plenty big right there.
Okay.
Withdrawal into oneself is not true. Diagnosed before the age of 2. Don't think so. I think more boys than girls. I would say that it's characterized by a persistent pattern of inattention.
Hey, look at that. It's ADHD. Yep. And it's very difficult to diagnose them before the age of 4.
Well, there you go.
And it's 4 to 9 times more common in boys than girls. And it's not withdrawal. That's not ADHD.
Yeah, that's what I was saying.
All right. Clients diagnosed with somatization disorder.
Oh, my.
Planning care, which nursing intervention should be included.
Kimosabe.
All you can do is throw out the bad ones on these questions and see what you get.
All right. Well, it ain't 1. Explore, let's see, encourage exploration of source of anxiety. It's not an anxiety problem. Jeez. In planning care. Well, I guess I don't like that, though. I don't encourage. I guess, redirect the client to the physician when somatic complaints are expressed.
The actual answer is 2.
No kidding.
Somatization is soma means body symptoms, usually related to anxiety. I'm super anxious, so I get nauseous. I have pain. We have to figure out what the source is.
The client diagnosed with somatization disorder,
which is anxiety unconsciously expressed through somatic symptoms.
Okay.
Okay.
I ain't sure that that's correct, but okay.
Hey.
No, I'm not saying that that's not the right answer. I'm just saying I don't think that's the correct definition.
Well, this is what they're giving you to remember. Somatization, body symptoms related to something like anxiety. Okay. Nurse focuses on feedback that's client-centered rather than focusing on feedback that meets the nurse's needs. This is one of many strategies of non-threatening feedback. Which nursing statement is an example of this strategy? That's a lot of words.
Okay, number 3.
It is 3.
The only one that don't say me or my or I.
That's it.
Well, tell me, but still it's.
Yeah, tell me about how you feel. Yeah, but it's not saying my feelings versus yours. It's tell me what you think. All right, client monitored on an inpatient, a client monitored in an outpatient psych clinic is taking clozapine. White blood cells 6,000, granulocyte count is 1,400. Based on these values, which intervention is appropriate?
Stop the medication.
There's 2 of those.
Yeah, I see that.
This is an interesting answer.
I'm going to say you're going to call them because of the white blood cell count.
It's not the white blood cell count.
Is it the granulocyte count?
Granulocyte count.
Oh, crap.
What's our normal white blood cell count?
5 to 10,000.
And what's our
white blood
cell? Crap. You were thinking platelets again.
I don't know why in the world I did that. Holy crap.
Yeah, I was like, low. That's not low. Yeah, low granulocyte count.
As soon as I saw that, I saw, oh, that's low.
Yeah, and granulocyte count is 1,500.
Yeah.
That's your normal.
Dang it.
It's okay. I was like, what do you mean? What do you mean?
Well, because I just misread or didn't think or however you want to say that. White count. I thought the white count was low.
It's okay. That's what we're doing this for.
Dude.
Client's diagnosed with OCPD.
Oh, man.
Which cluster would the personality disorder be categorized as each of the axes? Multi-actual system. Would the nurse expect to find this documentation?
Obsessive compulsive disorder.
We had our 5 axes and our clusters of ABC.
Yeah. Let's see. A personality disorder is 2. Is it not? So I'm going to say cluster C, axis 2.
Yeah, you get it. Grouped in cluster C is correctly as axis 2. Personality disorders and mental retardation begin in childhood or adolescence, persist in a stable form into adulthood.
Whew.
For B,
I was pretty sure it was axis 2, which narrowed it down to 2 answers, and then I was pretty sure that cluster A and B it wasn't in there. I was thinking it was towards the end.
Just so you know, cluster B's are antisocial, borderline, histrionic, and narcissistic. BAHN. Remember ban. B is ban. Let's see. Axis 1 is clinical diagnoses. During an interaction with a nurse, a client, although interacting appropriately, does not make eye contact, which is a true statement about nonverbal communication.
Well. I'm going to say nonverbal communication does not have the same meaning for everyone.
You win. Yes, not interpretation of nonverbals can be problematic. All right. It's a hard one. Shaman from the Iroquois tribe comes to the hospital to collaborate with his tribe member's physician. The physician attempts to shake hands. The shaman lightly touches the physician's hand and quickly moves away. How should the physician interpret this gesture?
The shaman is snubbing the doctor. That's probably true. The shaman's angry that he was called away from his family. That's probably true too. Shaman does not believe in traditional medicine. The shaman does not feel comfortable with touch. Maybe he thinks the doctor's hands are dirty. Let's see. Crap. Iroquois tribe. That's a Native American Indian tribe. And I don't even have any idea whether they believe in traditional medicine or not. I'm sure they don't. That's what I'm going to pick. They don't believe in traditional medicine.
The actual answer is 1.
Crap.
It actually says something very interesting. Native Americans do not engage in small talk, touching, hugging, or demonstrative displays of emotion. They view the handshake as aggressive as for Native Americans. A handshake may be accepted with a slight touch or just passing of the hands. Native Americans and the U.S. Health Service are respectfully collaborative regarding health care.
Well,
right. That's good to know.
I understand, but that's a poorly worded answer because I don't think that is accurate either. But because I know for a fact that Native Americans touch one another, and I know that because actually I've spent quite a bit of time out west, and so around Native. Now, not that particular tribe. I don't have any idea where they're from, but anyway.
Yeah, again, it's just a theory-based thing.
Yeah. Anyway.
Yeah.
If it was, if number one had been worded differently, I would have chosen it because I actually thought that was probably the right answer anyway. But I just
always in general.
I don't think that they don't feel comfortable with touch. That's not it. I don't think that's the right word to use. So anyway.
Yeah, and I agree. It's just, again, theory-based. Theory-based.
Well, for future reference, Native Americans are uncomfortable with touch.
Small talk, touching, hugging, or demonstrating emotion.
Yeah.
For theory-based purposes.
Mm-hmm.
The nurse is interacting with a client on an inpatient unit. The client states most forward action, grows life, double plays, circle uniform. Which charting entry should the nurse document about this exchange?
That's word salad.
That is word salad. Circumstantiality.
I was looking for the right answer in there, and it's the very end, the last two words there.
Yep. Circumstantiality is unnecessary, tedious, circumstantial details. Does that make sense? Tangentiality is different from circumstantiality, as they never get to the point of the communication with tangentiality. And perseveration is the persistent repetition of the same word or idea in response to different questions. All right. When a client experiences a manic episode, the nurse would expect to assess which of the following. Select all that apply.
Yee! Manic. Grandiosity, flight of ideas, pressured speech, and psychomotor agitation.
That's right. Client diagnosed with bipolar disorder states, my mom has a history of depression. While teaching about predisposing factors using a biologic theory, which client statement indicates the client teaching has been successful?
Oh, jeez. Well, biological theory, I'm going to say the answer is 1.
It is 1. High risk of becoming a family history issue. That was a fun one.
Well.
All right. Client diagnosed with thought disorders having trouble expressing fears of discharge to the treatment team. Functioning in the role of an advocate, which is an appropriate nursing response.
Ah, man. All right. An advocate.
That's your key on this one.
Yeah. I'll say it's 3 then.
It is 3. Yes. Being present is supportive.
I wanted to pick 2 or 4 really bad.
Both of those would be considered therapeutic, except 4 uses the I statement.
Yeah, they're not advocating for them though. So I'll remind you. That's.
Yep. Which the following tools is used to assess for tardive dyskinesia?
I love me some tardive dyskinesia. Well, I don't know if there is a such thing as an abnormal involuntary movement scale, but that's what it is. So
that's what it is.
Okay.
Yeah, actually, we talked about that too. The AIMS or ALMS score.
Okay.
Very shortly.
Okay.
But assessment for dyskinesia, bizarre facial tongue. Yeah. AIMS is comparative scale documenting changes over time. Do you remember
I don't know. I don't remember that. But
Do you remember the CAGE assessment?
No.
It's to assess alcohol or substance abuse.
Okay.
CAGE stands for, have you ever felt the need to cut down drinking? Have you ever been annoyed by criticism? Have you ever felt guilty about the amount of drinking? I had an eye-opener, drink first thing in the morning to steady your nerves. That's your CAGE assessment.
All right, then.
And then, of course, you got your GAF score. Let's see.
Lord have mercy.
Student's nurse is learning about dissociative identity disorder. Which statement indicates the learning has occurred?
Two.
It is two. One personality to another is usually sudden, dramatic, and usually precipitated by stress.
Yeah, I'm kind of stressed myself. I'm thinking about becoming somebody else.
No, I need to change personalities for a moment.
Yeah.
All right. We're not making fun of anybody.
No, I know. That's true. But I mean, I need to change into somebody who can answer psych questions right now.
There we go.
That's what I meant.
A client diagnosed with somatization pain disorder is admitted to an inpatient psychiatric unit. Which client statement would the nurse assess as evidence of primary gain?
All right, client diagnosed with somatization pain. Hey, well, there's your supposed anxiety disorder again. All right, pain disorder is admitted. Patient psychiatric, which client statement would the nurse assess? Primary gain? Oh, let's see.
Think of primary and secondary symptoms.
Yeah.
It's weird to think of it that way in psych, but it does help.
Well, I don't know what you're talking about, so that's not helping me at all.
Oh, okay.
All right, so primary gain, which means they are gaining something from having the problem. To me, that's what that means.
Yes, but remember, we're in psych.
I know. So it's my mom only listens to me when I'm complaining about the pain.
That's secondary.
Ah, crap.
Secondary to the pain.
All right. Well, then it has to be 3.
That's secondary to the pain.
Lower.
Because of my pain, these people are only listening to me because of my pain. Which one of these says primary, as in this disorder causes this pain?
This disorder causes the pain.
Mm-hmm. That's the primary.
Well, he doesn't, or this person doesn't say anything in here about anything that causes his pain.
Number 1.
That's not saying, that's not what that says. It says the back pain takes his mind off of his divorce. It doesn't say the divorce causes the back pain.
Well, let me read this a little bit better for you. The client is using pain as a method to avoid anxiety related to feelings of rejection associated with the pending divorce. This is a primary gain. The rest of them are considered secondary to the pain.
All right, well, I don't understand that, so we need to just move on.
Okay. Remember, somatization disorders, first symptom is pain. Or some sort of body issue. All right. A client is exhibiting sedation, auditory hallucinations, akathisia, and anhedonia.
I'm unhappy right now, too.
Yep. Is prescribed haloperidol and trihexyphenidyl. Which statement about these medications is accurate?
Oh, dang.
Whew.
Well, I know I don't, or at least I don't think either one of the Haldol ones are right. Let's see. So, does Artane decrease your hallucinations or your akathisia? Eeny, meeny, miny, mo, baby. Let's say that it decreases your hallucinations.
Oh, counteracts the akathisia.
Yeah. Okay.
It's we're looking for an antipsychotic to do auditory hallucinations, and that's your Haldol.
Well, that would have, I was going to say that'd have been fine, except for the fact that I didn't know what I still don't know what Artane is.
Well, remember, we talked about a little bit about to help us remember the antipsychotics. It was doles, zoles, tolls, and none of those fit into the dill.
Yeah, well, that's, I guess, seeing how I knew 3 and 4 wasn't the right answer, and why that should have been why I should have known that 2 was the right answer, shouldn't it, huh?
Mm-hmm.
Because if Haldol is the auditory hallucination, well, of course, it could have been a different one too, though. I don't know. Anyway, I didn't know what Artane was, or trihexaphenyl deal. I don't know what it is. So,
well, now it counteracts your extrapyramidal side effects.
Oh, yeah, okay.
Now we know.
Yeah.
The nurse is interviewing a client who's experiencing nihilistic delusion. Which statement confirms the presence of this symptom?
That'd be great if I knew what a nihilistic delusion was.
It's when an individual has a false idea that the self, others, or the world is non-existent. Nihilism.
Okay, because I know what a delusion is, but I don't recall ever hearing the word nihilistic.
I didn't until I read this question. So,
all right. Well, if that's the case, 3 is the right answer.
Yeah, you got it. The false idea that part of self, others, or the world is not existent.
Yeah.
The Matrix. There is no spoon. All right. Client has an IQ of 30. Which cognitive educational capability would the nurse expect to observe?
Crap, I forgot exactly how that goes right there. I'm thinking, Millis, the grades are pretty much in line with the numbers.
That's how I remembered it.
So, crap. Let's see. I'm going to say 4.
It's not 4. Remember we said the grade's in line with the number.
Yeah, I know, but there ain't no 3rd grade up there. So
right.
I guess it's 1.
That's 2nd grade, not 3rd grade.
Well, I know, but there's no 3rd grade up there.
How would you treat it? Okay, when we talked about this, we had 4 rounds. We had 4 of these IQ things. The first 2 weren't what we talked about with grades. It was the second 2 with grades. With the first 2 levels, you think age. You drop the 0 and you drop the first number. And you
okay, so that's a 3. I mean, that's a 3-year-old.
That's a 3-year-old.
Well, if that's the case, then that's client would profit only from systematic habit training.
That's exactly right. Remember your ranges. We had less than 20, which is profound mental retardation. You treat them like they're less than 2. Then you had 20 to 34, which you think of a 3-year-old. Then after that, you go to your grades. You go to 35 to 49 and 50 to 70. The 35 to 49 is the one where you have to think 2nd grade because it's your first grade setup. That was the only weird one. After that, 50 to 70, right in the middle is 6th grade.
I couldn't remember how that went.
That's okay, and that's why
I was thinking it was 3rd grade for some reason, but I thought there's no 3rd grade, so
yeah, it's either 2nd or 6th grade, and then the first 2, which are younger, you think of an age.
All right.
All right. 68, client newly admitted to an inpatient psych unit is diagnosed with major depressive disorder. Which diagnosis is priority at this time?
Client newly died, admitted, inpatient. Major depressive. Priority. Imbalanced nutrition, less than body requirements related to depressed mood.
It is not that.
Really?
This is a psychiatric patient diagnosed with this. This is, remember, psych had all these weird priorities. Your major issues here are going to be poor self-esteem, fatigue, which influences their ability to meet nutrition. There's nothing in the stem that says anything about their nutrition issue.
No, it's not, but it says what's their priority, and if they're depressed enough, then they don't eat. And so imbalanced nutrition is more important because that's physiological instead of psychological like the other three. That's why I chose it.
And it does say physiologic needs should be addressed before psychologic. However, nothing in the question says that they're experiencing imbalanced nutrition.
Yeah. And if I hadn't chosen that, it would have said, well, I know it doesn't say imbalanced nutrition, but people who are depressed are at risk for malnutrition. You know, there's no winning with this psych crap, in my opinion. It's not consistent. So they're admitted with a, doesn't even say why they're admitted, just because, or just that they have major depressive disorder.
Mm-hmm. Let's say it this way. 2 is correct, but it's not the most correct because this other one will encompass 2.
Oh, that is so funny. Well, you know what? I don't know. It's 1, 3, or 4.
It is 4.
I have no idea.
Low self-esteem is defined as a long-standing negative self-evaluation or negative feelings about self or capabilities of self. Feelings of low self-esteem are typical of diagnosis of major depressive. It can lead to deficits in self-care. If they have deficits in self-care, you get problems like social isolation, powerlessness, imbalanced nutrition, and also should improve. Therefore, this diagnosis should be prioritized.
Well, it doesn't say anything in there about abandonment.
I know.
Doesn't say anything about low self-esteem. Doesn't say any of that stuff.
I know. The other 3 are considered under 4. That's why.
Well, okay.
Yeah. What is the basis for providing psychiatric mental health nursing care?
Apparently, to keep them from feeling, low self-esteem and abandonment. What is the basis providing psychiatric mental health care? Well, I guess it's 2.
It's not 2.
Then I don't know.
That's part of it, but that's not the basis. The basis is 1, recognition, identification of functional patterns of response to actual or potential client problems, which is a behavior that
I'll there for that for just a second.
You got it. Psychiatric mental health nurse analyzes data to determine client problems. The problem station or nursing diagnosis is the response to actual potential problems and is the basis of underlying objective nursing interventions.
Yeah.
Which is a behavior that influences sleep patterns. This is behavior we're looking for.
Yeah.
Kind of get your mind back in here. There's a situational, a cognitive, a developmental, and then a behavioral option up there. You're looking for the behavioral option.
Well, I think it's one.
That's situational, not behavioral.
Well,
because that occurs during certain situations.
Yeah.
As well as the other one.
Well, a stressful situation is situational.
That's the answer.
You've got to be kidding me.
Behavior factor of using sleep to avoid stressful situations influences sleep patterns. Adolescence would be your developmental, and your intensive learning would be cognitive, not behavioral. The nurse is assessing a client diagnosed with autism. According to Mahler's theory of object relations, which describes the client's unmet developmental need. Go ahead and give this one a good, fun guess.
I was going to say, I don't have any idea.
If I get this on the NCLEX, I'm going to be like, whatever, next.
Yeah, I don't know anyway.
Give it a guess. I'm thinking autism.
Oh, according to Mahler's theory, first of all, I don't know who Mahler is. And then client's unmet developmental need. Well, source of fulfillment can't be right because they're too young for that.
Correct. Separateness
of self. I don't know. Need for internalization of sustained image of love, object, and person. I don't think they're old enough to know what that is either. So I think it's one.
It is one. The Mahler is similar to Freud in many of his steps. He uses 6 steps, but birth to 1 month is the normal autism phase of Mahler's development theory.
Just in case I hadn't told you yet, I hate Psych.
Oh, are you sure you don't like Psych?
I hate Psych.
Okay. Thiamine deficiency is a major problem for clients diagnosed with alcohol dependence. Of the presenting signs and symptoms caused by deficiency, what is the most life-threatening?
I'm going to say 4. Hello?
I'm here. Sorry. That's not 4. Impaired platelet production risk for hemorrhage is a complication of cirrhosis and not directly related to thiamine deficiency.
Well, okay.
We're just talking specific. Now, I guessed 4 on this one, but then I had to realize thiamine deficiency can cause issues later on or your alcohol can cause issue with your liver. But we're not talking about that. We're talking specifically about thiamine deficiency.
Okay. Well, then say 3.
It's not 3.
Oh, that's blood coagulation abnormalities. Once again, you're bleeding to death.
And remember, we're getting thiamine deficiency. 3 is, once again, cirrhosis.
Okay.
Not a thiamine deficiency.
Holy cow. I don't have any idea what thiamine deficiencies cause. So let's say paralysis of ocular muscles, diplopia, ataxia, somnolence, and stupor.
That's it. Paralysis of all these are symptoms of Wernicke's encephalopathy. This is the most common form of thiamine deficiency in someone who's alcoholism. All the other things are issues with cirrhosis, which can be caused by the alcohol dependence, but not the thiamine deficiency specifically. And there's a quick death resulting from this if they start getting that. What drug is commonly prescribed for clients diagnosed with narcolepsy?
Amphetamines.
Ah! You know what, a benzo or barb?
Yeah. They went down to one of these, stupid knowledge questions because I can't answer any of the other questions.
You got that one right. Let's move to the next one.
Yeah.
Difficulty initiating or maintaining sleep is to insomnia, as parasomnia is to.
Jeez. Well, I guess it's 2.
That's hypersomnia.
Well, I had no idea.
Okay. Somnia is still sleep. We have insomnia, which is difficulty maintaining or initiating sleep, but we're looking for parasomnia. Different. Paranormal. Different. Somnia.
Well, let's go with 3 then.
It is 3. Parasomnia, unusual, undesirable behaviors during sleep.
They needed to put more answers like number 4 in there.
That's not 4.
No, it's not 4. That's
well, technically, isn't that against? You don't
more, yeah, they need to put more stuff like that in there so you can pick out the right stinking answer.
Yep. Unusual, paranormal, different than normal. You look for different, unusual, undesirable behaviors. Sleepwalking, screaming, crying.
All that makes sense once you read the rationales.
Oh, absolutely. It's hindsight 2020.
Maybe they should give us a rationale sheet.
Yeah, I'd be like this rationale for each one. Oh, well, let's choose the right answer.
Yeah.
Which factor is associated with the etiology of ADHD from a genetic perspective?
God, really? Man. I'm going to say it's 2.
It is 2. More likely than normal children to have siblings who are diagnosed with this.
I'm the only one out of 7 kids in my family that has it, though. So
that's okay. We're okay with that. We're part of an elite group of ADHDs.
Yeah.
A client diagnosed with antisocial personality disorder has the nursing diagnosis of ineffective coping related to parental neglect, as evidenced by I broke the jerk's arm, but he deserved it. Which short-term outcome is appropriate for this client's problem?
Parental neglect? Four.
Short term.
Well, bells, I don't know what short term is in there.
Well, there's only one that's actually short term. The rest of them are considered long term.
Okay, well, the only one that says anything about that is 2, but that doesn't have anything to do with, recognizing what he did was wrong. That's talking about verbalizing unit rules.
And it is 2. Short-term outcome is stated observable and measurable terms, sets a specific time for achievement, specific rules, and is written in positive terms, all which should contribute to the final outcome of having increased ability to cope appropriately.
Yeah, well, like I said, I don't see that because he's talking about it's a parental neglect. I broke the jerk's arm as if it's his kid's arm.
Well, again, all we have to look at, and that's extra information that may be helpful, but we're looking at that ineffective coping. What's the short-term outcome for somebody with ineffective coping? Verbalize understanding the rules and consequences for infractions by end of shift. The rest of them is discharge. That's long-term.
Yeah.
Negative behaviors, establishing meaningful relationships. That's not even one. That's not going to be short-term. And 2, we don't even have a timeline. And 3 is within the year, or 4 was within the year.
Well, anyway, I didn't pick it because I didn't think it related to his problem.
Select all apply. 60-year-old woman has been experiencing delusions of persecution, depressed, and flat affect for 6 months. Which the following factors would rule out a diagnosis of schizophrenia at this time? Select all apply. Remember, we are doing theory. So.
Yeah, I don't have any idea, but I'm going to say 1, 2, and 3.
That's it. That's your answers. Medical conditions have need to be assessed. Schizoaffective disorder and mood disorders with psychotics must be ruled out. There can be no major depressive, manic, or mixed episodes for it to be schizophrenia. And symptoms of schizophrenia generally appear in late adolescence. Age is outside the range, making a diagnosis of schizophrenia unlikely. Client diagnosed with antisocial personality disorder is facing a 20-year prison term. The client's been prescribed sertraline for depressed mood. Which intervention would take priority?
Three.
It's not the priority. You need to do that, but which one's the priority?
Well, personally, I think you ought to let them kill themselves, but I guess it's 1.
It is 1. Monitor for suicidal ideations related to depressed mood.
Yeah, I see that knowledge of self and, being able to, put aside your own personal feelings affected me there.
Mm-hmm. Clients newly admitted to an inpatient psych unit. The following nursing diagnoses are formulated for this client. Which of these would the nurse prioritize?
I'm guessing it's 2.
It is 2. Safety is always your priority.
Right. We don't want them hurting themselves.
Nope. Which describes the therapeutic communication technique of focusing?
I guess it's 4.
Yes, therapeutic technique in which the nurse takes particular notice of a single idea, word, or theme, directs communication to draw the attention to the meaning and significance. 81. You got 19 to go, Jeff. 16-year-old client has complaints of binge eating, abusive laxatives, and feeling down for 6 months. Which statement is reflective of this client's symptoms?
Oh, I couldn't find the question. It's at the bottom of the page. Okay.
Yeah, sorry, I can't roll down.
No, that's all right. It's not a problem now. I just thought that you scrolled up and I couldn't because I looked away for a second. All right, 16-year-old complaints of binge eating, abusive laxatives, feeling down for the last 6 months. My heart breaks.
Don't be a psych nurse, Jeff.
I know. No, I'd never make it. I need, intubated and sedated patients. That's who I need. All right. A 16-year-old client complains of binge eating, and I'm still just stuck on that. It's just crazy. Abusive laxatives, feeling down. I'm going to say it's 1. Bulimia.
Yes.
Is it bulimia?
Yes, it is bulimia. Because remember, they're not going to be down with anorexia. They're going to be like, oh, happy peppy, until later. And then your abusive laxatives and binge eating is bulimia nervosa.
That's what I thought.
What information is important to teach a client who's recently been prescribed ziprosidone?
Geodon. All right. Oh.
Do you remember? I'm sure you know what Geodon's classification is.
Yeah, they give it to people in the hospital all the time to knock them out. Because they're combative and a pain in the butt and whatnot. So they give them a big old dose of Geodon so they sleep all night. That's what they do with it. I don't know why this person is going to be. Geez, I don't know. Yeah, I didn't even realize you gave this stuff to people who weren't inside the facility, but apparently you do.
This is more just knowing about the medication administration and such.
Bothersome symptoms. Yeah, they're bothering you, so you give them Geodon. Oh, God. Well, I don't have any idea what the answer is, and seeing as how agranulocytosis is a really big problem, I'm going to pick 2.
The 2 is actually talking about clozapine.
Okay.
The actual answer is 3. It needs to be taken on a full stomach to help with absorption. Geodon is considered an atypical antipsychotic. Your dones, your pines, etc. Dones, pones, zones, pines. So, yeah, you have to, for clozapine, you look for agranulocytosis. For ziprasidone, you need to take that on full stomach. Yay, questions of meds.
Well, like I said, the only thing I had to go on is what little I've seen that drug given for. And like I said, they give it to people who are a pain in the butt, so they can render them unconscious and flat of their back for 6 to 8 hours. That's why they give it in the hospital.
Let's see, a nursing instructor is teaching the neurochemical effects of Lexapro, escitalopram. Which statement by the student indicates an understanding of the content presented?
Antipsychotic is what they're. I just had to look that up. I didn't even know what Geodon's class was. Antipsychotic.
Oh yes, that's what I mean. An atypical antipsychotic.
Well, apparently, if you give enough of it, you can render somebody as you can render them basically, an inert, particle for a little while. Yeah. All right. Nursing instructors teaching neurochemical effects of Lexapro. Lexapro, it is 4.
Yep, increased amount of serotonin. It's the SSRI.
Right. I knew it was an SSRI. At least I thought I remembered that was an SSRI, so I was having to read down through there and look for it.
All right. Which client statement would best support the diagnosis of ineffective coping related to recent loss of spouse?
I'm having some ineffective coping related to the recent loss of ability to answer psych questions.
It's okay. It's okay. Again, we'll just try to get, when we get to that section of the NCLEX, we'll get down to like level 1, answer the questions, and get past it.
Man, I just am hoping and praying they don't ask me many of these questions. I'd rather answer OB questions. At least they're freaking factual. All right. Client statement. Support nursing diagnosis of ineffective coping. I use a glass or 2 of wine before bedtime. That'd be 1. Ambien to help me sleep. I need help. I use the gym. Okay, let's go with 2.
It is. Alcohol is a bad thing. All right. Which situation would place a client at high risk for life-threatening hypertensive crisis?
Oh, crap. All right. Hypertensive crisis. Well, apparently Nardil combined with one of those 4 drugs is not good for you.
No, it's correct. Nardil is a bad one if you combine it with something.
All right. Huh. Out of those, I'm going to pick crap. Colace, that's a cool. Kemosabe.
Just think about, we're thinking life-threatening hypertensive.
I am thinking.
And we're thinking psych.
I am thinking and that's the reason why I wasn't going to pick it, because it was a psych drug, but I was actually leaning toward Prozac because I don't think the rest of them will cause the problem.
That's right. Remember, we try not to combine MAOIs with other antidepressants. Phenelzine is an MAOI. You combine it with antidepressants, you can have big issues. You win, Jeff. You got 1.
I don't know if I got 1. I don't know if I told you yet, but I hate psych questions, dude.
A client states, after retirement, my husband divorced me and my children left for college. The nurse responds, it sounds to me like you're feeling pretty lonely, which is a description of the therapeutic techniques used by the nurse.
After retirement, my husband divorced me and my children left for college. Sounds to me like nobody likes this lady. All right. Sounds like you are feeling pretty lonely. Which is a description of the therapeutic technique. I'd say that it is it's 4.
Not 4.
Damn, then it's 2.
It is 2.
Crap. I was going to pick 2 and I thought, nah, I don't think it's 2.
You were about to say 2. I was like, I heard you say it.
I almost picked 2 and then I said, no, I think that's just repeating what she said, basically.
Yeah, 2 is
rephrasing it.
Implied.
Huh?
2 is verbalizing the implied.
Yeah.
And 4 is restating.
Yeah, I know. That's what I'm saying. It sounds to me like that's kind of like, it kind of is restating. You're basically saying, I'm lonely.
All right, 87. What's a client diagnosed with major depression has a nursing diagnosis of low self-esteem.
I'm having some right now.
Which is an appropriate short-term outcome for you, Jeff.
Oh. I don't think there's any way I'm going to be decreasing a fear of failure. Day 2, day 3. I guess it is. I'm going to have to demonstrate. No, that ain't got a time frame.
It's related to self-esteem.
I got all kind of self problems, bro. A client will exhibit increased feelings of self-worth. Day 3. Short term. See, I don't know how. I don't know. That's another problem right there. Just what is short term?
It depends on the timeline they give.
Yeah, that's exactly right. Short term is, right now, this afternoon.
They don't like themselves.
No, I don't like them either.
So
let's see. Fine then. Let's verbalize 2 positive things about themselves by day 2.
Jeff, I'm going to need you to choose that because you're right. So from now on, every day you need to have 2 positive things verbalized to me.
I got all kind of positive feelings about myself, but psych is not one of them.
I'm going to need you to demonstrate 2 positive psychiatric.
Okay, yeah. Now there we may have to have some work here. I need to see, I need to maybe go into some counseling from one of our instructors.
Oh, I'm Dr. Dave. I'll help. All right. A client states, I know that the night nurse has cast a spell on me. Which nursing diagnosis reflects the problem?
Oh, Lord have mercy. I'm thinking that's some disturbed thought process.
Yay! She didn't see it. She said it. She thought it.
Yeah.
Which situation would place a client at high risk for life-threatening hypertensive crisis? Oh!
Here we go again.
Yeah.
There's a tranny drug in there. I like that. That's funny. I'm going to say the tranny drug with a diet pill.
You got it. MAOI again, taken with a pill with diet pill would increase risk for hypertensive crisis. It's a diet pill. It's all epi.
That's always the diet pills, man.
All right. Client diagnosed with body dysmorphic disorder has a diagnosis of self-esteem disturbance. Which short-term outcome is appropriate for this diagnosis?
They won't hack their leg off by the end of the day. Where is that? I don't see it. That's what body dysmorphic disorder is, isn't it? All right. Self-care, positive attitudes about self. Client will interact with peers at school. That ain't it. Demonstrate coping by 4. Let's say it's 2.
I was going to say.
Number 2. It's by set day 3.
Yes, it is 2.
Yeah, positive attributes.
So, Jeff, tell me something positive about psychiatric nursing you feel about yourself.
I'm not going to cut my leg off today, Dave.
Oh, that's a good psychiatric.
How's that? Even though I hate my leg and it shouldn't be here, I'm not going to cut it off.
There you go. Client diagnosed with AIDS becomes confused and has fluctuating memory loss, difficulty concentrating, and diminished motor speed. Which would be the probable cause of this client's symptoms?
Let's go with age dementia complex.
There you go.
Even though I, didn't know that, I just, thinking that's probably the right answer.
You got it. All right. Believing in the dignity and worth of a client is to respect.
Oh,
as acceptance and non-judgmental attitude are to.
Man. I'll guess genuineness.
No, that refers to the nurse's ability to be open and honest.
Empathy.
That would be feelings.
Well, I don't have any of those, just in case I haven't told you yet.
It's 2, rapport. Acceptance and non-judgmental attitude. You want to establish a rapport, an acceptance and non-judgmental attitude with patients.
Well, I'm having some judgmental attitudes about these questions.
I hope you love them.
No, I don't.
A client diagnosed with major depressive is prescribed ibuprofen, bupropion, and sertraline. The client states, "Why am I on 2 antidepressants?"
Because you're really depressed. All right. Let's say 3.
It is 3. I was hoping you weren't going to say 1.
Huh?
I was hoping you weren't going to say 1.
Oh, well, they do give bupropion a lot of times for smoking,
but there's nothing in the stem that says it. So yeah,
I know, but I mean, I would, but they do.
Yeah, and that's what it says. Bupropion can be used for smoking.
Well, I was actually looking for some kind of synthesis answer, but I couldn't find one. So,
all right, let's see. Nurse assessing a client in the mental health clinic for 3 weeks. The client's been exhibiting eccentric behaviors, blunted affect. There's an impairment in the client's role functioning. Symptoms are reflective of which phase of the development of schizophrenia?
Crap, man, I don't have any idea.
We talked about this online yesterday, actually.
Well, we very well may have, but I apparently wasn't present. And seeing as how there's only one of them up there that has the word schizophrenia in it, I'm going to pick 3.
No, that would mean, remember, schizophrenia requires 6 months.
Well, it says these symptoms are reflective of which stage in the development of schizophrenia.
Yep, and look at your timeline.
I see that it says 3 weeks.
Yeah, and schizophrenia requires 6 months of the symptom. Otherwise, it's schizotypal. So right now we're at 3 weeks.
Okay, well, what is that, prodromal phase then?
Prodromal, yes. Characteristics of prodromal include social withdrawal, impairment, role functioning, eccentric behaviors, neglect of personal hygiene and grooming, blunted affect, disturbance in communication. But again, the big thing, you have to think about your timeline there.
Mm-hmm. Well, that would have been fine, but I didn't realize, that there was a timeline,
Mm-hmm. Schizoid, we talked about schizoid versus schizotypal. Schizoid was just those quiet basement dwellers.
Right.
And schizophrenia, again, you think 6 months, not 3 weeks. And then you have to start having your hard and soft symptoms as well with schizophrenia. And residual is when things kind of go away, but you're always considered at least being residual. Remission.
Well, I'm glad you explained that for our video audience.
You remember it now, too.
No, I'll never remember that.
We did that whole big PowerPoint I made.
Yeah, it doesn't matter. I didn't remember it now, so I'm sure I'm not going to remember it in 3 weeks.
Which intervention is a nurse's priority when working with a client suspected of having a conversion disorder? What?
Oh, God. What's a conversion disorder?
It doesn't matter. You don't need to worry about that.
I don't.
Just read your questions. You should be able to get it. It's a big key in psych nursing.
Is it a big key in psych nursing?
Mm-hmm.
Oh, it's guaranteed I'll get it right then. Well, I don't know, except for I'm thinking it might be 2.
It's not 2.
Well,
you're not going to confront them about the anxiety for somatic. It's 4. Priority for the nurse to monitor assessment, lab tests, and vitals to rule out organic pathology before you work. Always work on the physical before the mental. If there's nothing.
well, of course we should, except for the last time when I worked on the physical and they said, "Oh, it's not that. It's not the priority." When they're starving to death because they're not eating because they're depressed, that's not a priority. That's,
no.
That's physical. Remember?
That's physical. That's right. That's when it's okay.
But it was wrong up there.
Yes, exactly.
That's what I'm saying about this crap. It's irritating.
Which is an example of the therapeutic technique of exploring. One of these is placing an event in a timeline or sequence. One of these is offering general leads.
Those are all asking someone, in my opinion, to give you more information. So,
well, yeah, they kind of are, but there's just separating them.
Well, that's what it is. Was this before or after?
Was this before or after is placing an event in a time or sequence.
After that, you
is considered a general lead.
Give me an example of.
Is considered exploring.
How does that compare with?
Is considered encouraging comparisons.
Well, there you go.
That's a good. So, what was your answer on that one?
Apparently, it's 3.
Yeah, you got it.
But I had no idea because every one of them is exploring to me.
All right, a client becomes agitated in a group therapy and yells, "You're all making me worse."
Yeah,
this would be an appropriate response by the group leader.
Oh, yeah. Jeez. Maybe you'd like to go. I'd like to go to another group from now on. Is what I would like to do. Well, you sound angry and frustrated. Can you tell us more about it? Is that the right answer?
Yes, it is. All right, a client admitted to the inpatient psychiatric unit following a manic episode is given lithium carbonate. Which serum levels would the nurse expect on discharge?
Well, buddy, I remember 1 is good, 2 is bad. Only problem is you got, I think I don't know if it goes as high as 1.4. I'm going to pick 1.
You have the idea. That's your normal maintenance. They're just following up with a manic episode. You want 1.4.
Well, of course.
For managing the acute manic episode. So 0.9 is what you want them to normally be at. But if they have an acute manic episode, you go up to the 1.4, up to 1.5 to keep them for the actual episode. So you had the thought pattern right.
Oh,
One's good, 2's bad.
Well, of course, yeah. Once again, you want to keep them in the therapeutic level, unless, of course, we decide we want them outside the therapeutic level.
Well, then you go, this is a therapeutic level of an acute episode.
I'm about to have an acute episode.
Which of the following are tasks of the orientation phase of the nurse-client relationship? Select all that apply. I remember taking this and getting that wrong.
I was going to say I don't know what's in the orientation phase, but let's think about it for a second. Orientation. I'm going to say 4 and 5.
5 is correct. 1, 2, and 5.
1, 2, and 5.
Contract is the task of the orientation phase. And then the identification of the strengths and limitations during orientation. And then 5 would be formulation of nursing diagnostic statements. You want to go further. Let's see. So for 3, problem solving is a situational crisis, occurs afterwards, working phase, and promoting clients' insight is part of the working phase as well. Orientation is meeting, greeting, and figuring each other out.
Gotcha. That's what I thought it was, except for the fact that I don't know what goes in there. You know, I figured it would be the, assessing and coming up with your nursing diagnosis things, maybe, your first 2 of your 5 nursing steps.
And you did. That's part of 5, the formulation of nursing diagnostic statements.
Yeah, well.
All right, and last one for this. Client's been admitted to the inpatient psych unit expressing suicidal ideations, complaints of insomnia, and feelings of hopelessness during an admission assessment, which nursing intervention takes priority.
Play loud music and keep the lights on so they can't sleep. I don't know. See.
You should know this one now.
All right. Admitted to inpatient psych unit expressing suicidal ideations. Using humor. Yeah, that's a good one. Evaluating blood work, teaching the client relaxation, evaluating family history of mental illness. Jeez. All right. I don't see no safety crap in here, but humor, I know that ain't it. Admission assessment. Jeez, let's go with 4.
That's not priority.
Yeah, well, it is to me.
Blood work, thyroid, and electrolytes. Always look for your issues physically before you treat the mental.
Yeah, buddy.
Woo! Yay, psych, huh?
Yeah. All right, I'm done with psych.
Okay, now it's time for psych questions. Psych drugs.
Dude, I'm not sure I'm going to do psych drugs.
Okay.
I don't see any point in going over shit I don't know and ain't going to learn.
Well, then why don't let's take a little stop here. I'll stop the broadcast.
Oh.